Good morning, wherever you are. This is Miles Carter from ConferenceHype. Our segment will focus on cardiogenic shock in a toddler with rickets. From the 2026 July 22 edition of Pediatrics. Dilated cardiomyopathy in pediatric patients is most commonly of idiopathic, genetic, or infectious etiology, but rare cases are reported secondary to vitamin D-deficient rickets. Mild rickets is typically associated with skeletal deformities, delayed gross motor milestones, and growth failure, while severe presentations may involve hypocalcemic seizures or DCM. We report a 16-month-old male patient presenting with lethargy, tachypnea, hypotension, and hepatomegaly who was found to have severe left ventricular dysfunction and associated cardiogenic shock. Initial management included intubation, inotropic support, and cannulation to venoarterial extracorporeal membrane oxygenation. He had hypocalcemia on presentation, laboratory studies demonstrating a low vitamin D level, and radiograph findings of rachitic rosary, splaying of distal metaphyses, and generalized demineralization leading to a diagnosis of vitamin D-deficient rickets. From the 2026 May 1 edition of Pediatrics. Since 1991, the CDC has recommended screening for hepatitis B virus infection in pregnancy and universal hepatitis B vaccination of all medically stable infants at birth, serving as a core strategy to prevent perinatal and postnatal infection and eliminate HBV transmission nationwide. On December 5, 2025, the Advisory Committee on Immunization Practices voted among women who screen negative in pregnancy. Parents decide, in consultation with providers, when or if to vaccinate their child for hepatitis B, and if not at birth, then aged no earlier than 2 months, and consider collection of infant immune titers to guide decision-making for completing the vaccine series. We conducted a comprehensive review of the evidence on the safety, immunogenicity, efficacy, and effectiveness of the birth dose and a delayed first dose, and of the potential role of serology for clinical decision-making. From the 2026 May 1 edition of Pediatrics. Background, summarizing prediction models for developmental outcomes after very preterm birth. Methods, prediction models for developmental outcomes can support perinatal decision-making. Results, 38 publications were identified describing 99 newly developed models and 18 external validations of 11 different existing models. Discussion, although many prediction models for developmental outcomes after preterm birth exist, external validation is rare, and Rho B is high. From the 2026 July 23 edition of Pediatrics. Background, access disparities persist across centers performing pediatric liver transplant. Methods, cross-sectional analyses of all active U.S. pediatric LT centers using the Scientific Registry of Transplant Recipients program-specific reports from January 1, 2023 to December 31, 2024 was performed. Results across 59 centers, median volume ranged from 0.5 to 34, and new listings ranged from 6 to 53. Discussion, inequality metrics show that pediatric LT activity is concentrated in a small subset of centers.
This is ConferenceHype. Stay with us, coverage continues.
From the 2026 May 1 edition of Pediatrics. Background, to estimate influenza vaccine effectiveness in the pediatric population attending primary care in the European Union and European Economic Area in 2022, 2023, and 2023-2024. Methods, general practitioners swabbed and interviewed patients with acute respiratory tract infection. Results among 10,368 children in 2022-23, 3286 tested polymerase chain reaction positive for influenza virus. Among 9270 children in 2023-24, 1567 tested positive. Discussion. In 2022-23 and 2023-24, more than two-thirds of vaccinated children were protected against primary care attended influenza infection in Europe. From the 2026 July 23 edition of Pediatrics, immunocompromised pediatric patients, including hematopoietic cell and solid organ transplant recipients, those undergoing chemotherapy for malignancy, and those receiving biologic response modifiers for autoimmune or inflammatory conditions, are at risk for severe disease from vaccine-preventable respiratory viral infections such as influenza, SARS-CoV-2, and respiratory syncytial virus. These children face higher rates of hospitalization, intensive care admissions, and mortality, reflecting contributions from an immature immune system, absence of immunologic memory, and/or increased environmental exposures. Immunization recommendations for immunocompromised children are largely extrapolated from studies conducted among healthy children and/or immunocompromised adults due to a paucity of primary data on immunological responses and vaccine efficacy in immunocompromised children. Trends in vaccine hesitancy in the general population, ongoing transmission of respiratory viral infections in the community, and suboptimal vaccination rates among immunocompromised children and their household contacts further compound the risk for this vulnerable population. From the 2026 May 1 edition of Pediatrics, background, we aim to compare outcomes of patients who received a limited sequence brain magnetic resonance imaging with those receiving head computed tomography scans in the emergency department. Methods, we conducted a planned sub-analysis of a prospective cohort of children evaluated for new neurologic complaints. Results of 191 children receiving fast MRI scans, 159 were found to be eligible. Discussion. This planned sub-analysis found that fast brain MRI had less missed pathology, higher sensitivity, and higher negative predictive value without increasing ED or hospital LOS for patients presenting to the ED with general emergent neurologic complaints. From the 2026 May 1 edition of Pediatrics, Helicobacter pylori is a bacterial infection with a high prevalence in resource-limited regions. Pylori infection in children presents with nonspecific and variable clinical features, making diagnosis challenging. We describe a pediatric patient who presented with fever of unknown origin, anorexia, weight loss, and anemia. Despite an extensive evaluation, the etiology remained unknown until This case underscores the importance of including H. pylori in the differential diagnosis of children presenting with FUO, particularly those with recent travel to endemic areas, where exposure to more pathogenic strains may result in significant disease.
This is ConferenceHype. Stay with us, coverage continues.
ConferenceHype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. ConferenceHype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors. From the 2026 May 1 edition of Pediatrics. Background: the objective was to comprehensively describe the patterns and trends of household cleaning product-related injuries among children treated in U.S. emergency departments from 2007 to 2022. Methods: the National Electronic Injury Surveillance System database was used to examine cases of unintentional, non-fatal household cleaning product-related injuries among children aged 5 years or younger. Results: an estimated 240,862 children aged 5 years or younger were treated in U.S. emergency departments for household cleaning product-related injuries. Discussion: the consistently high number of household cleaning product-related injuries sustained by the youngest children and new products that have entered the marketplace in the past decade highlights the need for stronger product packaging standards, with emphasis on ensuring that spray bottles and other commonly accessible containers meet child-resistant packaging requirements. From the 2026 July 22 edition of Pediatrics. Background: to evaluate feasibility and diagnostic and process qualities, as well as the clinical benefit of newborn screening for urea cycle disorders. Methods: between 2016 and 2023, 624,480 neonates were enrolled in the German NBS pilot study, including NBS for UCDs by tandem mass spectrometry. Results: NBS for UCDs demonstrated high sensitivity and specificity with a positive predictive value of 0.2. Discussion: NBS for UCDs is technically feasible and enables early diagnosis. From the 2026 May 1 edition of Pediatrics. Background: childhood obesity disproportionately affects low-income and racial ethnic minority communities that tend to also have poor housing quality and obesogenic neighborhood environments. Methods: using longitudinal data on a cohort of 399 children from JD and a nearby comparison group without redevelopment, we conducted differences analyses. Results: JD children experienced lesser increase in overweight obesity prevalence, BMI Z-score, waist circumference, and waist-to-height ratio than the comparison group. Discussion: JD redevelopment was associated with a significantly lower increase in childhood obesity prevalence within its first 2 years. From the 2026 July 24 edition of Pediatrics. Background: pediatric care is becoming increasingly regionalized. Methods: we performed a retrospective repeated cross-sectional study of the kids' inpatient database in 2009, 2012, 2016, 2019, and 2022. Results: over the 13-year study period, overall admissions decreased by 61,344 per year. Discussion: transferred-in admissions and costs increased, with greatest relative increases in rural hospitals, non-medically complex children, and select admission diagnoses. This is Conference Hype. Stay with us, coverage continues. That's it for now for Conference Hype's coverage of the July 2026 issue of Pediatrics. If anything was missed, tell us which article deserves follow-up. Tag us on X. Add your perspective in the comments, share this review with your clinical team, like the video, and subscribe with notifications turned on for the next journal broadcast.